Good day, everyone. Welcome to my report about the child with special needs, specifically on the learning disabled ADHD or attention deficit hyperactivity disorder. ADHD is one of the most common neurodevelopmental and neurobiologic disorders of childhood. It is usually first diagnosed in childhood and often lasts into adulthood. Children with ADHD may have trouble paying attention, controlling impulsive behaviors, or be overly active. These symptoms are present before the age of 12 years. The incidence is more common in boys with a ratio of 2:1 in children and 1.6:1 in adults. Although the cause is unknown, scientists are studying causes and risk factors in an effort to find better ways to manage and reduce the chances of a person having ADHD. Current research shows that genetics play an important role. In addition to genetics, scientists are studying other possible causes and risk factors, including exposure to environmental, such as lead, during pregnancy or at a young age, alcohol and tobacco use during pregnancy, premature delivery, and low birth weight. The disorder is characterized by three major behaviors. First is inattention. This includes symptoms such as difficulty organizing tasks and reluctance to do those that require mental effort over time. Second is impulsiveness. This includes a child acting before thinking and therefore having difficulty with such tasks as waiting his or her turn, blurting answers before a question is completed, and interrupting or intruding on others' conversations. With hyperactivity, children may shift excessively from one activity to another and can be described as on the go or act as if driven by a motor. The signs and symptoms of ADHD. A child with ADHD might daydream a lot, forget or lose things a lot, squirm or fidget, talk too much, make careless mistake or take unnecessary risk, hard time resisting temptations, have trouble taking turns, and have difficulty getting along well with others. So what are the types of ADHD? Many people think of ADHD as a single disorder, but there are three distinct ADHD types: inattentive, hyperactive impulsive, and combined. Each type is diagnosed according to a specific configuration of a symptom and based on the degree to which the symptoms cause impairment. Understanding ADHD subtypes can help you better understand and manage your condition and how it affects your day-to-day life. So this is a graph showing the approximate prevalence distribution of the subtypes of ADHD, namely the inattentive type, the hyperactive impulsive type, and the combined type. Let us proceed to the assessment part of the report. So inattention is the predominant manifestation as the child gets older. During adolescence, symptoms of hyperactivity are usually limited to fidgeting or an inner feeling of restlessness or impatience. Deciding if a child has ADHD is a process with several steps. There is no single test to diagnose ADHD, and many other problems like anxiety, depression, sleep problems, and certain types of learning disabilities can have similar symptoms. The criteria for diagnosis of ADHD includes initial history, physical examination, and completion of evidence-based rating scales by an individual who is familiar with the child, such as the parents, the teachers, the primary care providers, and other caretakers. A good initial history should include a complete birth history and environmental history. Consider developmental milestones, dietary history, social history including child abuse, neglect and foster care, past infections such as encephalitis. Additionally, a family history is important to review as ADHD is more common in first-degree relatives. The physician or nurse will perform the physical examination, which is designed to rule out other causes of behavior problems. Example, child with visual impairment who is unable to see the board may not have ADHD but gets off-task behavior because he or she cannot see assignments clearly. Evaluation includes height, weight, body mass index, vision, hearing, and blood tests such as CBC to rule out anemia, thyroid function, lead screen, genetic screen, and toxicology screen. Physical examination is done to assess for comorbid conditions that are common with ADHD, such as specific learning disabilities, which composes of 10 to 40%, oppositional defiant disorder, depression or anxiety disorders, bipolar disorders, fetal alcohol effect, Tourette syndrome, and psychosocial morbidities. As a rule, children with ADHD do not have a deficit in intelligence, although they may seem to be because of their impulsive behavior and awareness that their behavior is upsetting to others. On physical assessment, they often show many soft neurologic signs such as difficulty performing tests such as the finger-to-nose test. Children with ADHD also tend to show mirroring with these movements, like their second hand is imitating what the first hand is doing. Children may not show the normal responses of graphesthesia and stereognosis. Graphesthesia is the ability to recognize shape that has been traced on the skin, while stereognosis is the ability to recognize an object by touch. Cuneiform movements or aimless movements, such as raising of the fingers when asked to stand with arms outstretched, are often present. More definite neurologic signs, such as unilateral Babinski reflex, may also be present. So let us proceed to the therapeutic management of ADHD. So there are varieties of treatment methods. They are often used in combination for the management of children with ADHD. The first one is the environmental modification. So the construction of a stable learning environment is crucial for children with ADHD. Many children may benefit from educational accommodations such as preferential seating, extended time for test taking, written list of assignments and due dates, and note-taking support. There is also the behavior management, which its main goal is to increase appropriateness behavior and decrease negative behavior. Children with ADHD respond best in an environment both at home and at school that is structured and predictable with clear and consistent rules and expectations. Consequences need to be established and discussed ahead of time and delivered immediately. Correct behavior that anger is normal but should be directed at the child's disruptive behavior and not at some incident that happened because of the child's inability to sequence, filter, or integrate concepts. Urge parents to make sure their child recognizes their anger is at the behavior, not the child. It is easy for children with ADHD to develop poor self-esteem because although they are intelligent, they face extra challenges in order to succeed. Helping parents build their child's self-esteem at every developmental stage possible is an important nursing action. Another therapeutic management is family support. There are also several organizations and groups that offer support and guidance to families with such cases. Another management is medications. Medication management is a proven treatment, but not all children and teens need to take the medication. It is still the parents' personal decisions after thorough explanation of its side effects and expected responses. Medication is helpful in reducing the excessive activity of children, as well as lengthening attention span and decreasing distractibility. Below is the list of the most common medications used in ADHD. There are short, intermediate, and long-acting stimulants. Stimulants work by stimulating dopamine receptors, so there is more regular nerve transmission, which results in increased attention span. Stimulants may be used alone or combined with behavior therapy to treat children with ADHD. Studies show that about 80% of children with ADHD who are treated with stimulants improve a great deal once the right medication and dose are determined. Finally, another management is managing the symptoms by promoting a healthy lifestyle for children with ADHD. Having a healthy lifestyle can make it easier for the child to deal with ADHD symptoms. Here are some healthy behaviors that may help. First, developing healthy eating habits such as eating plenty of fruits, vegetables, and whole grains, and choosing lean protein sources. Second, participating in daily physical activity based on age. Third, limiting the amount of daily screen time from TVs, computers, phones, and other electronics. And lastly, getting the recommended amount of sleep each night based on age. So that is the end of my presentation. Thank you very much and have a nice day to everyone.